Oh, shoot. I'll be back.
You never see me coming.
I'll be back. Hey, guys. Governor's here.
All right, so I am going to turn this microphone over to Governor Beshear.
Well, good morning to Kentucky nurses.
Good morning.
It is always great to be with our healthcare heroes. Y'all are making a difference daily for our people in Kentucky. Let me tell you, I know we've all been through a lot these past 6 years. Whether it was a pandemic, when your work and your courage every day saved lives, or whether it was after tornadoes and floods, because every county, every area I'd go to, we would go to that staging area, and you know who was there? Our teachers and our nurses, making sure that our people were cared for in their time of need. During the scariest times, you were always there for our people, helping them to get through those difficult days, but then also helping them to live a fulfilling and healthy life. Since I've become governor, we've now been through 15 federally declared weather disasters.
Yeah.
This one not quite done. As well as that pandemic, 2 helicopter crashes, and a plane crash. But each and every time when the worst has happened to us, we have seen the best in our people. We've seen Kentuckians come together to care for each other and to make sure that we get through those tough times to those good times. We've seen healthcare in Kentucky expand in so many incredible ways. We've seen the expansion of Medicaid to dental, vision, and hearing. And to me, it was pretty simple. If we're arguing that somebody should go back to work, they need a pair of glasses to see well enough to drive to work. We want them to be safe at work, they need that hearing aid so that they can hear those instructions. The idea that when we provide high quality health care to our people, they are more productive and they can live those better lives. I've been proud of how we've expanded access in so many different areas. Whether it was the AVA Center in Pikeville, where finally a parent with a special needs child is not told the number one thing they should do for their child is to move. That's wrong. And thankfully, no one in Eastern Kentucky has to hear that anymore. Or whether it's opening the first hospital in West Louisville in 150 years.
Woo.
Been so proud of that work we've done together. But as you know, right now, healthcare is facing some pretty scary times. The president's big, ugly bill is the most existential threat to rural healthcare that I've seen during my lifetime. According to the Kentucky Hospital Association, it could close 35 rural hospitals. It could lay off 20,000 healthcare workers, and 200,000 of our Kentucky neighbors could lose their coverage. On top of that, while Congress was willing to vote yes for tax breaks for the richest of Americans, they voted no to extend tax credits to help people afford coverage on the exchange. Those same plans reimburse the hospitals that we're talking about. And in the current House budget, it contains $850 million less in Medicaid than the one I proposed. So you are here at an incredibly important time. We can not just fully fund Medicaid, which we need to, but we can do so much more. My budget takes on these failures by the federal government because over these next 2 years, we've got to get our people and our healthcare system through it. We need not only each and every one of you still employed, we need a lot more of you if we want our state to reach its potential. So the first thing my budget did was try to make up for that fact that that big, ugly bill is going to cut dollars that are available to nursing students right now. My proposed budget contains $25 million for nursing loan forgiveness. You deserve it. And we want to make sure that it provides $100 million to lower the cost of coverage on Connect. We've got to make sure that people don't fall off that plan and they don't downgrade to a plan where they're not getting the services that they need. It expands the number of Michelle P. waiver slots for families. So many families desperately waiting for that call so they can get the services they need. It contains a $125 million rural hospital fund because that rural hospital transformation fund is not one that's going to directly support those hospitals. It's going to push more towards telehealth, which will push more jobs out of eastern and western Kentucky, which we cannot allow to happen. I believe our people are best. I believe that their lives are best when they can see a healthcare practitioner in their own hometown, when they can take a couple hours off work instead of taking a day to drive to see someone, or the next day driving their kids, or the next day driving their parents. So I appreciate that you all are engaged. You're here to talk about the good work that you do and the fact that people need to have access to you, that when they can come and see you, when they can get the preventative services, that not only can we better their lives, in the long term we can save this Commonwealth money too. As you're here, I hope you'll also lift your voice in other areas that you know will directly benefit people in your profession. I believe that one of the most important things we can do in this session is pass pre-K for all 4-year-olds in the Commonwealth of Kentucky. I don't have to tell y'all that things cost too much right now. You know, the car insurance bill, the utility bill, groceries going up, all of it squeezes us day in and day out. But pre-K for all is something that we can afford just on sports betting revenue that'll save folks with a 4-year-old about $6,000 to $12,000 in that 1 year. It typically adds about $9,000 in earnings to a family for 6 straight years, $54,000 more that a family would make. It gets people back in the workforce earlier. It could add 70,000 people to Kentucky's workforce, but I'll use the reason that I know matters most to you. A lot of y'all help kids with their health care needs, but half of our kids show up not ready for kindergarten right now. They're failing before they've ever walked into that public school that certain legislators want to criticize. 50%. They come with fewer vocabulary words. Some don't know their colors. There was a kindergarten teacher I was talking to the other day, and she said she had 5 kids that showed up on day 1 that weren't potty trained. And that kindergarten teacher is supposed to produce results. This is something that 30-something other states have done. West Virginia did it 20 years ago. I hope I never have to say again, we're 20 years behind West Virginia. But I love when you all come up for your advocacy day each year because you do what this government should be doing. You don't argue Democrat or Republican. You don't talk about blue or red. You don't talk about left or right. You talk about the basic everyday needs of our families. I'm convinced for the future of this Commonwealth and for the future of this country, we have got to spend the vast majority of our time not on these ideological battles, but the things that people worry about when they wake up in the morning. And when our families wake up in the morning, they're not thinking about the next political race. They're thinking about their job, and whether they make enough to support their family. They're thinking about that next healthcare appointment, how far they have to drive when it's over. They're thinking about the roads and bridges they travel, the school they drop their kids off at, and whether they feel safe in their communities. I think the reason that Kentucky is succeeding right now is focused on those issues, trying to push out the noise, push out the division, not accept people telling us that something's wrong with our neighbor. We want the very best for them. And I think when we live out those faith and values, that golden rule that says we love our neighbor as ourselves, and the parable of the Good Samaritan that says everyone is our neighbor, people see Kentucky for the special place that it is. Now, while we've got these federal challenges, let me tell you, the things going on in this state are amazing. I'll start with Moody's, just like we're doing right now in Kentucky, sets the stage for future generations. And I think the 2 most concerning things we're seeing in the country right now is the level of division and the new concern that the American dream is no longer attainable. The idea that if you work hard and play by the rules, you still can't succeed. That's where we've got to be as a government, making sure that if you work that job, you make a good enough wage to raise your family. You can not only pay the grocery bills at the end of the month, but you can take your kids on that same vacation that your parents took you on. That you can afford your first home before you're 40. That is the new average age for a first-time homeowner. That when you are sick, you can see that healthcare professional. That your kids go to a top-quality public school, that you have hope for the future. But when I see a big room of nurses like this, I've got a whole lot of hope for our future. Because like I said, I've seen you at the toughest times. I've also seen you at the very best times. And I know you're pushing for that better future. Everybody had to take time off or time out to come here today. and we're grateful. And every time a legislator walks in front of a group this big, and you look at them and say, don't cut Medicaid, it makes a big difference. They see that it's people from their community. They see the real life impacts that it has. And so I'm really grateful that you take that servant's heart that you have in your job each and every day, and you apply it wanting the best policy too. And let me end where I think I almost always start, but didn't spend as much time on today. The courage I saw from y'all in the pandemic is something I've never seen before, and I'm not sure I've seen since. It was scary. None of us exactly knew what we were dealing with, and people forget, especially in the beginning, it was deadly. And we did not have the PPE we needed to protect you. Yet healthcare professionals, nurses, every single day agreed to, volunteered, and walked into that COVID wing to try to help somebody. It wasn't just that it could hurt you, you could take it home to your family. People slept in garages. People slept in hotels or other places for months at a time to protect their family, but also to go in and to serve that patient. The projections that we had were scary. We were going to lose 2% of our population, 88,000 people. I can tell you how that felt when that landed on my desk, and that was the moderate count. That didn't happen because of you, because of the high quality care that people got immediately, because of that nurse being unwilling to leave that wing until everyone was taken care of, and having the courage to walk on it even when we didn't know enough and you didn't have what you needed to protect you. So I am eternally grateful. And at times when my job gets hard, I think about you. I think about that. I think about your willingness to do what's right at the toughest of times, and it gives me the type of direction that I need to make sure I'm doing the right thing in tough times. So thanks for being in Frankfort. Thanks for all the incredible work you do. God bless you. Work hard. Let's make sure we get a budget that's good for health care. Thank you very much.
Thank you for your continued support, Governor Beshear, to all the nurses in the state of Kentucky. We greatly appreciate you. Now we're going to have part two of Representative Camuels.
Part two, come on up.